Hi, my name is Robert Santoni and I'm a registered physical therapist. I'm also licensed in the state of California. I'm also ActiveComp president. I've been working for the last 20 years in long-term care facilities hand in hand with nursing staff doing patient care. During those years, several of my nursing colleagues were injured on the job. Doing patient care with improper lifting techniques or improper body mechanics. Sometimes patients were injured during patient care. By using proper techniques, lifting techniques, and body mechanic, those accidents should and could have been prevented. The role of ActiveComp today is to help you reduce potential bodily injuries. Protect your body by teaching you the proper techniques and ultimately protecting your residents. Always think before you act. Assess the situation before you move your patient and see if you can handle the resident by yourself. Do not take a risk and hesitate to ask for more help. If a resident is too heavy and requires more than half of your body weight, then it's too heavy for you. Ask for help. Planning is preventing and better than fixing. Your body is your working tool and it's vital for you to protect it. Your body is a support to your career, and protecting your body is also protecting your job and protecting as well your career. Thank you.
When you are carrying or transporting something heavy, it is important to keep the weight close to your body. When you need to pick up a heavy weight on the ground, something over 5 pounds, you need to bend your knees, bring the weight to your stomach, then use your leg muscles to stand up with the weight close to your body. Always use your leg and not your back to pick up anything on the floor, even something you might think is light. The closer your elbows are to your body, the less chances for injury. Always try to maximize patient strength rather than use your strength. Sometimes your patients will have limitations and will need assistance while turning in bed for changing a bed sheet or to relieve pressure, which helps to prevent skin breakdown. When a patient is in bed or obese and needs help rolling to one side, you must bend one knee and put it on the bed while keeping your back straight. Ask the patient to bend one knee. Ask the patient to grab onto the rail with the hand on the same side where they have their knee bent. Push the knee to the other side at the same time the patient is pulling them to that side. When you need to roll a patient over to one side, keep in mind it is easier to push than to pull. Imagine pushing a car versus pulling a car. Bring the patient's bed to a flat position unless otherwise indicated from nursing directives. Ask the patient if they can to use their arms to grab onto the rails. Ask the patient to bend their strong leg or both legs if they are able. Signal the patient to pull themselves up at the same time using both legs to push up. Control the movement with both of your hands. Keep in mind that the patient will always be able to help. To prevent injury, communicate and ask the patient for help with positioning. This will make your patient more comfortable and happy that they can help you. Always bring a patient from lying to sit from the weak side of the patient. If the patient's weak side is on the right, you will bring the patient from lying to sit from the right side. You will ask the patient to use their strong side to help you sit them up. Use the same technique as rolling a patient from lying flat position to one side. This means that the patient's bent knee is opposite the side that the patient is rolled towards. To bring the legs out of the bed, lower the rails and ask the patient to push themselves up with the opposite arm. When the legs go towards the ground or floor, the weight of the legs will help the patient sit up. It is very important to let the patient know what you intend to do. Communication is critical. Tell the patient what you intend to do and ask them for cooperation. Before standing a patient, make sure you know from the nurse how much assistance the patient requires. Don't forget the gait belt. Ask the patient to scoot forward to the edge of the bed until both thighs are out of bed. Bring the patient's feet slightly under the bed and put both their hands flat on the bed. Put your gait belt around the patient. Don't tighten the belt too much. You don't want to restrict the patient's breathing in any way. Many of our residents have respiratory disorders including pneumonia and COPD. Signal the patient to lean forward and push their hands and legs to stand up. If you intend to ambulate the patient, never have the patient stand up with their hands placed on the walker. This may result in the walker slipping. First, have the patient push on their hands against the mattress to stand up, then reach for the walker with their hands. The majority of employee and patient injury occurs during transfer. How you transfer a patient is critical. To do the transfer properly, it has to be thorough and thought out before being performed. Ask the nurse in charge or CNAs prior to transfer how much assistance the patient requires. To prepare the patient for transfer, communicate with the patient and ask for help. Position the wheelchair. The wheelchair has to be at a 45-degree angle from the bed. Always transfer the patient from their strong side. Always tell the patient what you're expecting from them. Prepare the patient with the same techniques with sit to stand and scoot to the edge of the bed. If a patient has frail knees, put a pillow between their knees and your knees to avoid bruises. Never let a patient grab you by the neck before transfer. Don't underestimate how much assistance a resident will require for transfer. It's always better to be safe than sorry. Ask for help if a patient may require more than one person for transfer. It's vital for proper transfer that they lean forward, have their feet under the bed, and scoot forward. It is impossible to stand up with your feet flat without leaning forward. The handle of the cane has to be properly adjusted so that it's at the same level as the patient's wrists. The cane is always placed on the patient's strong side. You will always stand on the opposite side of the cane. Since the cane is placed on the strong side, patient will normally lose their balance and fall towards their weak side. It's important to stand on the weak side, which is on the opposite side of the cane. Patient ambulates by bringing the weak leg forward at the same time the cane goes forward. The patient then steps forward with the strong leg. Both handles have to be properly adjusted so that they're both at the same level as the wrists. Identify the weak side of the patient and stand behind the patient slightly on the weak side, between 3 and 6 o'clock. Have your gait belt around the patient. Make sure that the length of steps are equal. Encourage patient to pick up their feet instead of dragging. This often occurs with patients who have Parkinson's disease. When a patient starts to fall, bend your knee behind the weak side or the side on which the patient is starting to fall. For example, if a patient falls on the right side, bend your right knee. With your gait belt, pull the patient back and lie the patient down on your right leg. Let the patient slide down on your leg safely to the floor. Never try to keep a patient from falling. It's better to prepare a safe fall with the right technique. Don't try to prevent a fall and take the chance of falling with your patient.
Okay, that's it. I hope that you were able to learn a few techniques and mostly learn some lifting and transfer techniques which will help you in the future preventing any potential injury. Have a wonderful day and don't forget, never take any risk. Thank you.